Hello, this is Dr. Gil Wilshire at Missouri Fertility in Columbia, Missouri. We've had a lot of questions regarding intrauterine insemination or IUI. So today we're going to show you an actual IUI as it's done. The purpose of an insemination is to have an army of sperm coming up the tubes, and hopefully 1 or 2 eggs are coming down the tubes. Eggs and sperm meet in the tube to make an embryo, and hopefully an embryo will go down the tube into the uterus in about a week's time and start a pregnancy. Our patient today was given some medications last week, and 2 days ago we saw with ultrasound that her ovary had a beautiful follicle that was ready to go. 36 hours ago she took an injection called a trigger shot that causes this follicle to pop right now and release an egg, which will hopefully get into her tubes very, very soon. 2 hours ago, her husband produced a semen specimen for our laboratory. That specimen was processed through what's called a chain of custody, and the sperm, after they were processed, have now been concentrated, cleaned up, and turned on. It's called capacitation. We'd like to get at least 3 million sperm for an insemination. Today we got 14 million sperm, which is really excellent. So we know these sperm came from this nice lady's husband. They're now in this catheter, and we've shared her husband's name with her, so we all know it's the right specimen. Now we're going to do the insemination at this point. So now we're going to sit down, and using a speculum, we're going to visualize our patient's cervix. You're going to feel a little pressure, ma'am. A little pressure. And visualize the cervix. And there it is. Now we're going to take a little swab. You might feel a little scratching sensation, ma'am. And now we're going to clean off the cervix. And now I can see it perfectly. Now we're going to take our insemination specimen. You can see it's a long little skinny tube that will go up inside the uterus. And you can see that doesn't hurt at all. I'm going to slowly push the sperm up into the uterine cavity, and they should be swimming up into her tubes over the next few seconds. There you go. And that's the intrauterine insemination. Now we'll take the equipment out. Very good. And ma'am, we can now put your feet together here, and you can rest here for the next 10 minutes or so. So there's an intrauterine insemination. Everything went very smoothly, and hopefully she has an excellent chance of pregnancy this cycle. This is Dr. Wilshire at Missouri Fertility. I hope you found that interesting.